Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. Ron is not with us today.
I've heard rumors that he is poolside at the moment. And I'm Jean Marie.
No, he's not poolside.
Okay.
He's working hard at work.
Okay.
Collectively, we're the hosts of PodcastDX. On today's show, we are talking about C-Diff with Christian Lillis. Christian is one of the co-founders and executive director of the Peggy Lillis Foundation. He earned his degree in political theory from the Brooklyn College City University of New York. He and his husband reside in the Kensington neighborhood of Brooklyn. Christian has 20 years experience in fundraising, advocacy, and nonprofit management for organizations like the National LGBTQ Task Force and the New York University Langone Medical Center. Thank you for joining us today, Christian.
Hey, Christian.
Hey, thank you so much for having me.
It's our pleasure.
Yes.
Christian, from what I've read, Clostridium, and I'm going to say this one way, and I've heard it pronounced three different ways.
Difficile?
We've heard difficile. We've heard a number of different takes on it. C-Diff.
C-Diff.
Infections are on the rise. Could you tell us what exactly is C-Diff and how the Peggy Lillis Foundation is leading the way in increasing C-Diff awareness?
Absolutely. So actually a couple of years ago, they changed the bacteria's name to Clostridioides difficile, which is even harder to pronounce. So we tend to say C-Diff or C. difficile, and that tends to be how doctors talk about it as well, just kind of cut out the very difficult Latin word. So C. diff is what they call a spore-forming gram-negative bacteria. And when they say spore-forming, they mean that it has a spore state, almost like an eggcorn, and then it has a vegetative state, almost like when an eggcorn, opens up.
Mm-hmm.
And the spore formation actually makes C. diff very difficult to kill, as opposed to other kinds of bacteria like MRSA or others that you've commonly heard of. So it is present in the guts, the colon, the lower intestinal tract of some adults. In its vegetative state, it causes infection in the colon. The infection usually causes severe diarrhea and inflammation or colitis. C. diff infections can occur after disruption to the balance of the gut microbiome. If your listeners are not familiar with the gut microbiome, it's basically an ecosystem of microscopic organisms like bacteria, viruses, and fungi, sometimes also called the gut flora.
Mm-hmm.
And we've evolved to sort of live in harmony with all these bacteria and microorganisms in our stomachs, on our skin. And they do a lot of good stuff for us. They help us digest food. But some of them, like C. diff, if they're allowed to grow out of control, can cause harm to us. So we started Peggy Lillis Foundation in memory of my mother, Peggy. And my mom died as a result of a C. diff infection on April 21st of 2010, when she was just 56 years old. And prior to taking my mom to the emergency room for persistent diarrhea, I had never heard of C. diff.
Mm-hmm.
My mom's C. diff infection resulted in her going into septic shock, and she passed away just 6 days after her symptoms started,
Wow.
and just 36 hours after she was admitted to the hospital.
Wow.
Before she had a C. diff infection, Mom was a healthy kindergarten teacher and a single mother. She came from she was one of 9 children from this big Irish Catholic family here in Brooklyn. And I don't know, my mom, I'm obviously biased, but I think my mother was like one of the best people I've ever met. So after my parents split up, she raised me and my brother Liam. She had quit high school to go to work when she was 16 or 17. So she got her GED, and then she went to college and eventually became a kindergarten teacher. And she was, kind of all of our friends' second mom. Like, ours was the cool house that you wanted to go hang out in. And so, you know, we were very shocked to have my mother die from an infection
Sure.
we'd never heard of. Um, we initially focused on raising awareness because my mom was a teacher and she believed that knowledge was power. And, one of the things that we noted early on was that, there were many people dying from C. diff. When my mom died, the estimate was about 15,000. Now it's 29, 30,000 a year. And yet it was very little public awareness. So right now, about 60% of Americans have never heard of C. diff. So 40% have heard the word, have heard the term, mostly couldn't tell you what it is. Whereas 85% of Americans have heard of Ebola. And literally one person has died in the US from Ebola.
Right, right.
So we wanted to address this lack of awareness and, use our mother's legacy and her story to raise awareness of the disease and, ultimately prevent other people from suffering the way we did.
Okay.
Well, we're
very admirable.
Yes, and we're both obviously extending our condolences to you and your family and your brother for everything that you've gone through, and we're just very proud of what you've done, and I'm sure she is.
Yeah, she sounds like she was a wonderful person and raised some
two
amazing
wonderful people.
Children.
Yes, yes. Thank you for that story, Christian. We've all heard at some point that we should limit our intake of antibiotics. Don't take antibiotics unless that you have to.
Right. And if you are prescribed, finish your dose.
Finish your dose, right. And don't take somebody else's antibiotic. How are antibiotics and C. diff linked?
So, as I mentioned earlier, we have this gut microbiome. And so most cases of C. diff, including my mother's, are precipitated by either current or recent use of an antibiotic. I'd say it's probably somewhere like 90% of cases, that the person's either on an antibiotic or has recently been on an antibiotic. And the reason for that is that when we take antibiotics, particularly oral antibiotics, where they go into our stomach, they kill off. They don't just kill off necessarily the bacteria that is making you sick. They kill off all the bacteria they find, especially like a broad spectrum antibiotic like clindamycin or vancomycin. And so once the good bacteria is gone, the C. diff, which as I mentioned earlier, creates this spore. It kind of survives that wave of antibiotics. And then once all the space is clear, oxygen, nutrients, different things, sugars, the C. diff is able to reproduce very rapidly and kind of fill up the space taken up, sort of given up by the other bacteria. And that's what produces what we call a C. diff infection. So, you could have a little bit of C. diff in your gut. If you're healthy, if your gut microbiome is in good shape, you're fine. But if you take those antibiotics, it wipes out the good bacteria and lets something like C. diff thrive. So, we don't want anybody who really needs an antibiotic to not take one.
Right.
But as you were saying, there's a lot of reporting, and we can get into more specifics about the amount of unnecessary prescriptions, people given it for what turns out to be a virus or a head cold, things like that.
Sure.
Yeah. And I guess that toxin buildup from the C. diff there's not much, you can do about that. So your mom was taking, once again, medications and medical terminology.
Clindamycin? Clindamycin?
Clindamycin.
Okay. Following a root canal. So it was like a very everyday procedure that millions of people have, a root canal. Is this the only antibiotic associated with C. diff?
No. So yeah, in my mother's case, she was given clindamycin following a root canal, prophylactically to prevent an infection. which is ironic.
Mm-hmm.
And so, really any antibiotic can precipitate a C. diff infection, but broad spectrum antibiotics, ones that kill a large variety of bacteria, are the most common causes. So this could include macrolides, cephalosporins, fluoroquinolones. I think a lot of people are familiar with fluoroquinolones. A lot of women take Cipro for urinary tract infections. Levofloxacin. I was doing really good up until that.
You were doing good. We were very impressed.
And then, antibiotics in the penicillin family are also more highly correlated with C. diff infections. But again, it really could be, any antibiotic. It's just the degree of risk.
Okay.
But no antibiotic is risk-free.
Okay. And Christian, I want to go back just a little bit. Had you heard of C. diff before your mother's illness?
And I think you said you hadn't, right?
No, and that was part of the shocking part of what happened to her. I had worked in healthcare. Lita said, noted when she introduced me that I worked at NYU Langone as a fundraiser for many years. I also, when I was in college, I worked as like a patient coordinator and associate for a radiology clinic. And I'm also a bit of a hypochondriac. So I'm generally better informed about health than the average person. And I think this points to something that I think it's useful for people to understand, which is that C. diff was first identified in 1978 as a cause of what they called antibiotic-associated diarrhea. Through the 1990s, it was mostly considered a nuisance disease that affected the elderly, but they were given more antibiotics, that cleared it up, they were fine. Then in the 2000s, 2004, 2005, it was first noticed in Canada that a new strain, a new variant, and we're all familiar with variants because of COVID. So a new variant called the North American Pulse strain was becoming the dominant version of C. diff, and that led to death rates increasing by over 400%.
Wow.
So in 1999, there were 800 C. diff related deaths in the US, and by 2006, there were more than 6,000.
Wow.
So that's a big jump.
Yeah. So it's something that has kind of snuck up on us, and now as I was saying earlier, we're at somewhere between 25 and 30,000 deaths. It depends on, did they have C. diff and die from another cause, or was, there's always going to be some, and something else I would say to you is that my mother's older sister was a nurse, and she was an oncology nurse. She's still, she's retired now. Thankfully, she's still here. But when she met us in the ER that day, and the doctors said to us that they thought my mother had toxic megacolon caused by C. diff, my aunt said, "How could she have C. diff? She's so young, and she's not been in the hospital in as long as I can remember." So a lot of healthcare providers, they think of C. diff as something that happens to elderly people, and so they don't look for it in younger people. So
okay. I did notice when we were doing research for this article, or for this episode, that not all states have or are required by law to put C. diff as a...
They don't have to report it.
They don't have to report it on the death certificate? Have you heard about that?
Yeah, so death certificates are governed by state laws. And there's also a lot of sort of professional latitude when it comes to like who fills them out. And also, and then of course, C. diff itself, the bacteria, or the infections, I don't recall off the top of my head, but about half of states require it to be reported by some healthcare facilities. But mostly the way that it gets reported is through hospitals participating in Medicare. And Medicare requires, as what they call a condition of participation, that facilities report their C. diff rates. Unfortunately, by the time that gets to the public, it's usually a year or 18 months out of date. It's not easy to find. You have to like know which website to go to. Like it's just not as readily available.
Right.
So one of the things that we're working on is making C. diff a nationally notifiable disease. And what that means is any place that it's diagnosed, anybody who diagnoses it has to report it to the state health department and to the Centers for Disease Control. And you'll be familiar with many nationally notifiable diseases like measles, COVID is a nationally notifiable disease. But then there are less common ones that we still hear about, like if there's an outbreak of E. coli, you'll see on the news, oh, this restaurant had an outbreak of E. coli. And that happens because it's nationally notifiable.
Right.
So you have to tell us in the moment. You can't, whereas you could be going into a hospital for a procedure, that hospital could have a terrible C. diff outbreak and they're not obliged to tell you that.
Yeah, that's terrifying.
Yeah, right. That bothered me.
And I was just thinking another means of monitoring the current situation, which is not pleasant to talk about, but
Sewage.
Sewage.
Yeah.
Just like they check this sewage in certain areas to monitor other possible outbreaks before they actually start getting reported. So things like polio, the sewage is monitored for things like that, and maybe the toxin produced by C. diff could be added to that. But yeah, it's sad. Yeah.
They have looked at wastewater. Like a study that was done in Illinois looked at, and we don't think of Illinois as a farming state, but it has lots of farms.
Yeah.
And what they found was that your risk of getting C. diff increased the closer you live to a farm.
Okay, that makes sense.
Because the same bacteria, like a cow can have C. diff, and that bacteria is the same bacteria that can infect us. Like it is, goes from animal to human very easily.
Okay.
And so, yeah, they have done those studies, but I don't think I'm not aware of any monitoring of that right now.
But that would be good to have in as a tool.
Right. As just a monitoring so that they can be aware that there's an uptick.
Right.
Yeah, they found more of it.
Yeah, and I won't get on my soapbox about having, farms that are sustainable and have, borders of trees and plants. But we're from Illinois. We're talking to you from Illinois, and my sister and Lita's daughter has a farm. So
yes. A hobby farm.
Hobby farm, yes. But it's a sustainable farm, where she has, breaks where there's trees and bushes and everything. So she's separated from other nearby farms, and it's better for the environment and, the animals.
I thought you said you weren't going to get on your
I'm sorry. Let me climb down.
Okay.
Because
get off your soapbox.
Okay.
Moving on to symptoms, Jean.
Okay. Christian, what are the typical symptoms associated with a C. diff infection?
So most people who get a C. diff infection will experience urgent and frequent watery diarrhea, anywhere from 5 to 15 times a day. And we've all had diarrhea in our lives, and going 15 times a day is a lot. The other symptoms include abdominal cramping, that feeling like you have to go urgently, fever, nausea, loss of appetite. And in severe cases, you can have a rapid heartbeat, experience dehydration, white blood cell count. You might see blood or pus in your stool. People lose weight if they have it for a long period of time. So, but the main ones are, diarrhea, fever, abdominal pain. Those are usually your first indications.
Okay, and then how are the infections diagnosed? Is it just by the symptoms, or do they have to do a sample, or?
So C. diff is what they call a clinical diagnosis, because as I mentioned earlier, you could have some of the bacteria in your stool. And so we have basically two kinds of tests. And again, COVID has educated us to a lot of things. And so they have, a rapid assay test where they test for the toxins.
Mm-hmm.
And usually that will be that those have about 80 to 85% accuracy, so they can miss some cases. And then
Sure.
they have what they call a PCR test, which is looking for the DNA of C. diff. And so those have a much higher accuracy rate in terms of whether or not you have C. diff bacteria, but you could have that and not be sick.
Right, right,
um,
right.
so it really is the doctor looking at the
A
results of,
combination.
yeah,
Right.
like you do a PCR, okay, you're positive for the bacteria. We do an assay test to make sure that you're positive for the toxins. And then they're also going to say, like, do you have a fever? Have you taken antibiotics? Like, they're going to do that kind of differential diagnosis.
Right.
And that's to determine whether or not someone has an active infection rather than just being colonized.
Okay.
Okay. And Christian, how are C. diff infections typically treated?
So, as odd as this may sound, the primary treatment for C. diff infections is additional antibiotics. So, both vancomycin and fidaxomicin are now considered the first line treatment. Generally, if you have a moderate case, you'll be given pills to take for 10 days. Fidaxomicin has been shown to slightly decrease the risk of recurrence of you getting another infection. If the 10-day course doesn't work, and it does work for 40, 50% of people that get C. diff, you may be given a second dose. You may end up getting one that's for a longer duration, 14 days instead of 10. But the issue in the people that we talk to the most are people who are battling recurrent C. diff, meaning, they had it, they took the antibiotics, maybe it got a little bit better, but then it came back. And so for those people, they end up on additional courses of antibiotics or a taper where like you start, for 30 days, you might take like one dose of the antibiotic, then a lower dose. And then if you fail antibiotics, they might offer you a fecal microbiota transplant. And so, but sadly, our options are kind of limited. FMT became really hard to get during COVID because COVID is present in stool. So they had to like do additional testing. But now the good news is that there are several new therapies in development. Some are narrow antibiotics that mostly just kill C. diff and leave the rest of your good gut bacteria alone. And then there are ones that are basically microbiome restoration therapies. So they're sort of derived or based on the same premise as a fecal transplant. And there are probably 5 or 6 companies right now that have those drugs in development. A couple of them are getting ready for FDA approval. So we're really hoping that we get one of those drugs on the market sooner than later.
That would be great. Great.
Absolutely.
And Christian, what steps could be taken to reduce a person's chance of developing a C. diff infection? I mean, like I'm going in for a root canal. I have to take an antibiotic because I have mitral valve prolapse, but now I'm nervous.
I will say it's really funny that she's saying this because
I have no teeth.
At the moment, she has no teeth.
I've already had my teeth taken out. I'm in the process of getting dentures. But I'm saying a person.
Okay.
If a person has to have a root canal and has to take an antibiotic, is there anything that they could take to prevent getting the C. diff infection?
So we definitely want to minimize the use of antibiotics. I mean, we mentioned before, and studies vary slightly in terms of the proportion, but, something like half of all antibiotics that are prescribed on the outpatient basis are not necessary. The person doesn't have an infection. So, the first thing I would say is, be up to date on your guidelines. As far as I'm aware, because my brother has mitral valve prolapse, they no longer require that for dental work. They used to require it even for cleaning.
Right.
So, ask your dentist about it, explain, especially if you've had C. diff before, if you're concerned about it, have that conversation. They may give you a lower dose, they may give you less. And then the other thing you can do is, sort of proactively is have a diet, the food that you eat be high in fiber, whole foods, and ones that have like a lot of probiotics in them.
Mm-hmm.
And like there are probiotic supplements and those can be useful, but ideally you want to get it from food.
Mm-hmm. Okay.
Okay, good. That's all good advice.
Yes, absolutely. And that answers one of my questions kind of for later.
Okay.
But
we're actually we are going to be releasing in a couple of weeks a nutrition and lifestyle guide for people battling C. diff or recovering from C. diff.
Oh, great. That's
great.
So
great.
that's something for folks to check out.
That's great. Well, yeah, we're looking
and it
forward
even
to
has
putting that-
recipes.
Oh,
Excellent.
very cool.
Excellent.
And it can be nice, something like that makes you feel like you're a bit in control, because a lot of times with a medical condition, you feel like you have no control over the situation. So you're enabling people to take back control and actually make changes to their lifestyle and their nutrition. So that's fantastic. Yeah, very, very, very exciting. And I was just curious, are there any risk factors that may increase one's chances of developing a C. diff infection?
So in addition, the primary one is antibiotic use, right?
Mm-hmm.
But beyond that, the other risk factors are being elderly, age 65 and over. There has been a correlation of people who take a type of antacid called proton pump inhibitors, or PPIs.
Yeah.
Mm-hmm.
And the theory there is that they lower your stomach acid and it allows the C. diff to kind of pass through your stomach, which is very acidic, and take up, residence in your colon. And then nursing home residents are at a higher risk if you're recently hospitalized. And then people who have a weakened immune system, just generally, like due to having HIV/AIDS or be it cancer treatments, autoimmune diseases, like those can be additional risk factors.
Sure. Okay.
All right. So
Thank you.
some things you can control, some things you can't.
Well, a lot of it, I don't think you have a lot of control
but
over.
at least you know what it is.
Yes. Yes.
Christian, what can
I think-
healthcare? Go ahead.
Do
Go ahead.
you have a bit of control?
Yeah.
Well, I was going to say, I mean, again, so my brother's a plumber for Kings County Hospital here in Brooklyn, which is basically Bellevue, but in Brooklyn. It's the big public hospital. It's the tier 1 trauma center. It's all that stuff. And he does plumbing, and he's since our mother passed away, they've tried to prescribe him antibiotics multiple times. And he'll get a little cut when he's doing something, and he'll tell them, this is what happened to my mother. Do I really need these? And oftentimes they'll sort of allow him to take a wait and see approach.
Okay.
And so so we do have some control. Like I think anytime you're given a medication, you should question it. Not saying especially if you go to CityMD or something. Like if you have a doctor and trust, and they know your concerns, that's great. But a lot of, especially younger people, don't have a primary care physician. I've noticed. I'm aging myself by.
I was going to say, yeah, we have no clue. We did talk about the other day that we come from a time when doctors made house calls, apparently.
Mm-hmm.
Yeah.
That was a good time.
Okay.
Yeah, mine doesn't make house calls, but.
And Christian, what can healthcare facilities like hospitals, long-term care facilities, dental offices, and other such places do to reduce the number of individuals infected with C. diff?
So healthcare facilities can play a huge role in reducing C. diff through what they call antibiotic stewardship programs. So these are programs that sometimes are health system wide. So it might include even the outpatient areas of a hospital, where before you're prescribed an antibiotic, it's kind of reviewed, and they have sort of ongoing feedback to doctors and prescribers. And the goal there is to not prevent anyone from taking an antibiotic, but to make sure the unnecessary ones don't get prescribed. And the hospitals that have good antibiotic stewardship programs have far less C. diff infections. And then the other area where most facilities are frankly lacking is infection control and prevention.
Mm-hmm.
So we've obviously seen a lot of this with COVID, but and C. diff isn't airborne in the way that COVID is, but C. diff can linger on surfaces for 6 months. Again, it forms a spore, it's very hardy. And unfortunately, hospitals, and the finance people at hospitals often see like the janitorial staff, the cleaning staff, the people that make up rooms between patients as a cost that isn't reimbursed, right?
Mm-hmm.
So in that case, they may have a cleaning staff that are poorly trained, not paid well, don't get sick days, so they come to work sick. These are all things that we saw with nursing aides during
Mm-hmm.
COVID, where they were going from one nursing home to another and basically taking COVID with them.
Mm-hmm.
So, hospitals that do a great job generally have janitorial working with the infection control people,
Mm-hmm.
and they kind of consider the janitorial team their first line of defense.
Sure.
Like a clean room, a clean bathroom, it's well cleaned, people washing their hands with soap and water. That's your first line of defense. So that's something, if if there's a hospital where you see your doctor and you get your treatments or your checkups, you should ask about that.
Mm-hmm.
And if you see a dirty room, you should say something.
Okay.
Yeah, that's great advice.
Good advice.
And even to the point where, how do they help healthcare providers and other staff launder their uniforms?
Oh, yeah.
Are they taking an active role in that? And, because you don't want somebody who's been wearing, their lab coat around and not laundering it on a very regular basis.
Yeah, I mean, we really need to get rid of lab coats.
Yeah.
And it used to be, it was after doctors made house calls, and also it used to be that, nurses and everyone who works in a hospital, when they showed up, they were given a uniform for the day, and that the
Mm-hmm.
hospital laundered those uniforms. And at some point that became the responsibility of the person who works at the hospital.
Right.
And so you do have people who go to work in their scrubs, leave the hospital in their scrubs.
Go fishing with their scrubs, come back with their...
Even running out to get lunch,
Right.
Whereas my cousin, she's a surgical nurse. So she gets her uniform when she shows up at work because it has to be sterile for her to go into the surgical room. So that's another area where, like, I think people can push back and say, like, we think hospitals should be actually laundering people's uniforms. Like, that should be part of what they do.
Yeah. Well, yeah, all really, really great advice. And then this is a little bit off topic, but...
No, not really, because he's going to have a recipe.
Well, no, because we talked about nutrition, so I kind of want to ask about something else. The dental practitioners are changing the way that they look at the mouth biome. And so they're changing their perspective on things. And instead of having a mouthwash that kills all the bacteria, which could be good bacteria, and toothpaste that kills all the bacteria, they're looking more for mouthwashes and toothpaste that help support a healthy biome in the mouth. And I'm curious if that will have an effect, a carry-on effect to having a healthier biome in your stomach and the rest of your intestines as well. And I know that
it's all one tube.
Yeah, I mean, I certainly don't think it would hurt. And I think the degree to which we raise awareness of, our interdependent relationship with bacteria, viruses, other microorganisms, and the more that the public understands that, the more they will, the more that they'll be like, okay, I don't need to take this antibiotic. Okay, I don't need to bleach everything in my house.
Right.
Like George Carlin used to have a funny bit about, how him and his friends used to go swimming in the Hudson River and they never got sick.
Oh, wow.
Our bodies have to be exposed to different things so our immune system builds up.
Mm-hmm.
And obviously vaccination and things play a role in that as well. But, there's, I think that, dentistry is coming around to this. They recently changed some guidelines about, how, and we were actually part of the feedback for this, how much, when they give antibiotics, when they don't. But it takes a long time for guidelines to change and for that to reach every practitioner.
Sure.
So it's definitely something to, for people listening to this, like, if your dentist says you need an antibiotic, ask why, which one, just have that conversation.
Right.
Okay.
Great.
Yeah, that's great advice.
Have you heard about C-Diff?
Yeah.
I'd like to avoid it, please.
Mm-hmm.
Yes.
Yeah.
So, Christian, what steps can we take at home to reduce our chances of becoming infected with C. diff or spreading the bacteria around our homes, especially if we live in a farming community?
Unfortunately, while most C. diff cases can be traced back to a healthcare interaction, the bacteria itself is found all over the place. They found it, on farms, in soil. I think it was the University of Texas did a study where they just went and swabbed every place they could think of, and they found C. diff every place they swabbed. So what we generally tell people that the best way to reduce their risk is to, be judicious with antibiotics and have a good diet. But if someone has C. diff, or if you have a loved one or you have C. diff, the best thing that you can do, the two best things you can do to prevent other people from catching it is to first, if you have more than one bathroom, designate a bathroom for that person.
Okay.
And everybody else uses the other one. And then when the infection's over, you want to clean that bathroom very well with bleach. Do your best to kill all the spores. And the second is, because most household cleaners, even like things that are made for the household are not made for cleaning like a hospital. Like they're much lower strength.
Right.
So since most household cleaners won't kill C. diff spores, what they recommend is using a cleaner that's 1 part bleach to 10 parts water.
Okay.
And that is a lot of bleach, so people should wear gloves when they use it. And basically what you want to do is kind of, put the solution down on the surface, let it sit for a few minutes, and then wipe it up. And we actually have, I mentioned that we're coming up with an eating guide, but we have right now on our website a C. diff caregiver guide. So it has this and other additional information on how if you have someone at home with C. diff, or if you have C. diff, the measures you can take at home to help prevent you from spreading it.
Okay,
very cool.
great. And another thing I noticed when I was doing research on the topic was that maybe this was also in Texas, but when they swab the shoes, 40% of all shoes have C. diff on it. And that made me think about the 10-second rule when, you drop something on the floor in the kitchen. Oh, it's only been there for a second. Well, excuse me, but if that C. diff is on my shoes and then it gets on maybe 10 seconds is
10 seconds,
too
it goes
long.
into compost.
Yeah.
Okay.
So maybe take your shoes off at the door and get rid of that 10-second rule. Anything that falls on the floor, get rid of it.
I mean, I think, we saw this with Asian cultures around masking, because because SARS and MERS, and they dealt with other avian flu. So they have a culture of masking in public, especially if they don't feel well. And of course, in America, we're all individuals, so we want to be mad about it. But the other thing that Asian people do is that they don't wear their shoes in the house.
Right.
So it's another step, that you can think about taking to just minimize it.
Sure.
We tend to wear slippers around the house, but we don't leave our shoes outside. And partially it's because we have a dog.
Oh,
and we're
yes.
she's tracking in whatever we're tracking in. So.
Right.
Yeah.
It can be challenging with puppies around.
Oh, yeah.
And well, you know what I was going to ask about, just another soapbox issue. In high school, it seems like, of all the courses that are available, there's, like chemistry, there's sometimes anatomy and physiology, there's physics, there's general biology, but they don't have microbiology in many schools. And I'd rather, instead of being, dissecting animals and things, I think I'd rather learn more about microbiology and how integral it is to everyday life. And
that makes sense.
Yeah, sorry.
I had microbiology
in high school?
Yeah.
You had everything in high school. I don't know.
Well, I liked science.
You did. I took every science course there was.
I did too.
Yeah. Okay.
But yeah, that's why we're doing podcasts.
We both like science.
Yeah, we can.
But no, I didn't get a chance to take it until in college.
Yeah.
I mean, I think it's one of those weird things where it's especially over the last 15 or 20 years, there's been such a focus on reading and math. And, I went to school earlier than that. Again, I'm dating myself. And what we really need is to focus on the whole person.
Right.
they should learn life sciences. They should learn about how their bodies work. And that's everything from like, general anatomy to like sex education. Like all these
Right.
things are important. And it,
And nutrition. God, we don't talk about that at all
and
in
coping
school.
skills.
And yes, okay. This could
okay,
be a
I'm sorry.
soapbox.
We could go on and
This
on.
could be a whole episode.
I mean, I'll join you for that episode because I have
Yeah.
a lot of thoughts about that.
Yeah, I agree.
We agree completely.
I agree.
As somebody who deals with, a lot of people who are battling C. diff, have lost a loved one. I lost my mom way before I was ready to do it. Like, there are just some days where we are just coping.
Right,
Yes.
right. So, Christian, how can our listeners learn more about the Peggy Lillis Foundation and your upcoming events?
So they can visit our website, which is fightcdiff.org. So fightcdiff.org. You can also find it at peggyfoundation.org, but Fight C. diff is a little shorter. And we're on most social medias, like we're on Facebook, and you can find us on Twitter and Instagram. And on there, we're at Peggy Fund, so PEGGYFUND.
Okay.
And we're pretty active, so it's worth following us if you care about that stuff.
Excellent.
Yeah,
We'll definitely follow you.
Yeah. Well, Christian, thank you ever so much for taking the time to join our show today. What additional advice do you have for our listeners?
So this is my personal soapbox.
Okay.
Jean.
Climb on up.
And so a very funny thing is that my mother was a big advocate for people, an advocate for us as kids, an advocate for her students and her fellow teachers, and was involved in her union. And so her siblings used to say that she got on the soapbox all the time.
Mm-hmm.
And then she was gone maybe 6 months, and we were at a family event, and I started, going off about something, and they were like, "Oh, I guess you inherited the soapbox from your mother." And I was like, "I sure did." So my whole thing is don't be a passive participant in your healthcare as a person, but also in our healthcare system.
Mm-hmm.
We spend $3.6 trillion on healthcare in this country, the most of any country, and we get poorer outcomes than a lot of other industrial countries. So you should be proactive about your own health, like eat a good diet, exercise, get your regular checkups, but also look into your local hospital system. What is their infection rates? Are they doing a good job of cleaning it? Are your elected officials keeping up on this stuff? Like, is your public health department in your city or your state, is it well funded? Like these are questions that almost never get brought up in like mayoral races or governor's races. And yet the last 2.5 years of COVID should teach us that like, this is a really important issue.
Right.
The ability of us, to respond to public health crises and to address longstanding ones like C. diff. Like we have the technology, the tools to cut C. diff, 80% probably if we applied them, but you have to create the pressure on the system. And that's a lot of what we do. So I would say, don't be afraid to demand better.
Excellent
you and your loved
advice.
one.
Excellent advice.
Yeah, and I love your soapbox.
Yes.
You can borrow it.
Thank you.
Thank you, Christian. And we'll make sure that we put links for the Peggy Lillis Foundation on our website.
Well, thank you guys so much. This was a real pleasure.
Thank you.
It was a pleasure.
It was our honor.
Oh, absolutely. And give that puppy a hug for us.
Yes.
We will. Hopefully you didn't hear too much of her.
No, that's
No,
okay.
I just heard her. Yeah, I was like, I was just waiting for my guys to
join in.
Yeah, to chime in. Oh, yeah.
If our listeners have any questions or comments related to today's show, they can contact us at PodcastDX@yahoo.com, through our website, PodcastDX.com. We're on Facebook, Meta, Mars,
I don't know.
Twitter, Pinterest, Instagram, YouTube, and TikTok.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard of this podcast.
Till next week.